Hi, my name is Megan. I will be presenting on cervical polypectomy. I am Megan. I'm a DNP FNP student at Weber State University. I am presenting on cervical polypectomy, and we will be using a specific patient scenario as follows. So Charlotte is a 32-year-old female. She has had abnormal bleeding, which happens after intercourse. She has severe anxiety, and she prefers that her life just runs perfectly. She likes everything in her life to be spot on. When she found out that she had a cervical polyp, this made her super nervous, and she was a little bit upset as to find out that it was caused, her bleeding was caused from this polyp. I have recommended that she get it removed, and the purpose of this video is to give her an overview of what a cervical polypectomy is, what she can expect, how she can prepare, and the aftercare. Hi Charlotte, I just wanted to kind of go over today so that you can understand what to expect from having a cervical polyp removed. Like you know, during the pelvic exam, we did see a cervical polyp. Now, most of these are non-cancerous and they're easily removed. Like, you will just come back to the office on a specific date, and we will remove it here in office, and then you can go home and just rest for the rest of that day or for a couple of days. So what you can expect when you come into our office is you will come in, and we will get you in position, and we'll talk more about that in a little bit. But you'll come in, we'll find the polyp, we'll go in and we'll grab the polyp, and in doing so, what we're going to do is we're going to separate it from the cervix. And then we'll apply a little solution that will help to stop the bleeding, and then you're all finished. Some common indications that you may have a polyp are abnormal bleeding after douching, after intercourse, after you've hit menopause if there's bleeding, and between periods, and also if you have heavy periods. In your case, like you explained earlier to me, bleeding after intercourse was a worry to you. And so we went in and we looked, and you for sure did have a cervical polyp. So we will go in and get that taken care of. So as you know, we were able to schedule you to come in and get this surgical procedure done here in our office 2 weeks from today. But I wanted to go over things so that you make sure that you have all the information you need to decrease your anxiety and to also know what you need to do prior to coming in. So the first thing is you need to make sure that you are not on your period, because we want to be able to see the polyp clearly. The next thing is if you're on blood thinners or using ibuprofen, naproxen, any NSAIDs, we would like you to stop those. And in reviewing your chart, it doesn't look like you're currently taking any medications. So just make sure that you're not taking NSAIDs, which are ibuprofen, naproxen, Celebrex, any medications like those for 3 days prior. We just want to decrease bleeding during this procedure. And then you are able to eat and drink like normal because we do not sedate you for this procedure. You will want to bring a driver, number one, for support. They can hold your hand during the procedure. They can be in the room during the procedure. If you don't want them in the room, they don't have to be in the room for the procedure. And just in case we have to give you some pain medications after the procedure, you'll have a way to get home. And then it's also important to make sure that you have an emotional support person that's going to be there in case you do get tearful and in case you do need some support that day. Just to let you know, you will be awake for this procedure, but we will do everything we can to decrease the amount of pain you're in. Now we will go over what's going to happen on the day that you come in for the procedure. So first off, you're going to come in, you can wear comfortable clothes, you can wear house shoes if you want, just wear comfortable enough clothes that are easy to take off and to take on. You will have to take everything from the waist down off. It'll be a lot like a pap smear. So we will give you a gown to put on to create privacy. We'll also give you a little wraparound blanket so that you are completely covered. And then we will have you get into what's called lithotomy position. So what we'll do is we will pull out the little stirrups that you put your heels in, just like when you come in for the pelvic exam. And you'll put your feet in those comfortably. You can leave your socks on so your feet don't get cold. And we'll have you scoot to the edge of the bed, just like a pelvic exam. And we will keep you covered during this procedure with that blanket. We will keep the room comfortable, and we will also keep you safe. Like I said earlier, your partner or whoever comes with you can stay in the room, or you can ask them to leave prior to getting into position. You can expect to feel some pressure during this. You'll expect to feel the devices that we'll be using. So we will be using a speculum to go in, and then we will also be using a clamp to grab on to the cervical polyp. So you'll be feeling those instruments, but we will tell you along the way, like I'll touch your inner thigh, and I will ask you before I touch your thigh, asking, hey, can I touch you? And then I will say, okay, we're going to touch the outside of the vagina, and we're going to open and put the speculum in. The speculum will be warm, and it will also be lubricated, so it should go in smoothly. Again, if you do have any discomforts or any sensations that you're like, oh, I don't like that, or oh, that hurts, you need to let us know so that we can make sure and adjust how we're doing things to make you as comfortable as possible. We will also help to alleviate anxiety and pain. Now, if you are severely anxious that day, we do offer an anxiety medicine that we can call into your pharmacy so that you can take it about a half hour before you get here. That's another reason that we recommend that you bring a driver. Now, things to expect after the procedure. More than likely, you will have some pain and cramping, and you will also have some spotting for a few days. We recommend that you use pads and not tampons. Normally, you'll be back to normal living 2 to 3 days after the procedure. And but if there are any complications, like if you're excessively bleeding or if your pain is not manageable, you do need to call us. And in regards to follow-up care, there's not a lot to follow up with unless you are having complications. And those were mentioned above, which are excessive bleeding and not manageable pain. Now, if you do by chance get a fever or feel like you have a possible infection, that would be another reason to contact us. In regards to follow-up care, you will just follow up a routine pelvic exam, and we will check to see if polyps have reoccurred. The likelihood is very rare, but there is a chance that they can reoccur. Like I said, we do send the specimen to the lab. In regards to the lab, the times can vary. Our lab takes about 3 to 5 days to get results back. And so we send every lab or every specimen to be assessed for cancer. And we will send it to be assessed, and then when it comes back, we will let you know the results, whether it is or is not cancer. But like I said earlier, it is rare. Charlotte, I want to make sure that all of your questions are answered. If you do have any questions, and you may have some now or you may have some later, feel free to give us a call. Also know that we as providers, myself and the other providers here in the office, are here to support you. Now, if you have any questions, if you feel uncomfortable, if you are nervous, let us know. We're here to help. And we will always get consent before we do surgery or before we do any procedure, even if it is in the office and not in the operating room. And we always recommend that you do have a support person at home, just to make sure that you're safe, and to make sure that if you need anything those first couple of days, that you have someone to turn to. I also wanted to let you know that we do have an open communication policy here at our facility. And if you have questions, you can call us 24/7. We have a provider on call 24/7. And they will know about your case, because we do have a meeting each morning to discuss the cases that are coming up that day. And these are my references. Thank you.